Welcome to the StellaLife Innovator series. I'm Liz Lundry, and today I have the honor of interviewing Dr. Mike Milligan. Dr. Milligan graduated first in his class from Southern Illinois University Dental School in 1978. He practices general dentistry with his daughter, Dr. Marissa Milligan, and he's a founding member, past board member, past president, and master fellow of the American Academy for Oral and Systemic Health. He is also the founder and president of oralsystemic.link.net, quote, saving lives through oral systemic health. Dr. Milligan has authored many articles in various publications, and he speaks to healthcare groups nationwide. I'm so happy to welcome Dr. Mike Milligan. Hi, Dr. Milligan.
Hi, Liz. It's an honor to be here with you. Thank you so much for allowing me to visit with you.
Well, thank you for your time today. You've been through so much and have so much to contribute. I'm really excited that we could talk today. So you and your daughter practice together at Eastland Dental Center, where you've dedicated yourselves to assisting families to achieving better oral health and wellness. Can you share your practice philosophy and how you do this for your patients?
Well, sure. I've been a general dentist for 45 years. Early on, I've loved the game of golf. I've won many different amateur golf tournaments. And I learned that if you do the right thing every day in practice and put the effort in, if you do the right thing today and every day, eventually the payoff will come and you'll do well in the tournament. Well, it's the same way in dentistry, it's the same way in life. And so my practice philosophy has been to treat patients the way we want to be treated. And then, basically to help people live better. Marissa, I've got 4 kids, 3 daughters, and one of them, the youngest, became a dentist as well. And so she joined my practice in 2015. 2 years ago in 2022, she purchased my practice and my suite. And so she's got the same philosophy. We just try to be honest, tell it like it is. The other thing you want to do for sure is be good at what you do. Yeah. I've told so many young people going into healthcare, look, you have the opportunity to really help people if you're good at what you do, but you also have the opportunity to hurt people if you're not very good at what you do. So part of that is educating yourself and making the effort to become very good at what you do as well. And we've tried to do that. And so, so that's pretty much it. We also, early on, I saw that the mouth had such a big influence on the rest of the body. The health of the mouth is the gateway to the rest of the body. And also that the body, the health of the body greatly impacted the health of the mouth. If you have healthy tissues throughout your body, you get your sleep, you get your exercise, you take good care of your body, your supplementation, your right nutrition, that affects your oral tissues as well. It's all tissues throughout your body. So I began getting interested in all aspects of how the mouth affects the body and vice versa. I've been speaking on that for the last 25 years around the country to other healthcare providers. As you mentioned, we started, Dr. Chris Kammer was the founder of the American Academy for Oral Systemic Health, but I was one of the early people. We were at the first meeting. Chris has been a good friend of mine for years and years. And so that's been a focus of our practice as well, our dental practice. And we've allied ourselves with several physicians. We've held meetings for physicians, dentists, and the public at our local country club, hosted several meetings and on oral systemic health, had physicians speak as well as we spoke. We've done many radio interviews and written articles and things like that. So the basis of our practice is total health. It's not just filling teeth or just oral health. We love that. And that's the foundation, certainly. Cosmetic dentistry, implants, good periodontal health. But we've tried to also include, well, we have included the whole body as it relates to oral health.
Yeah, as a longtime hygienist, and I also am an educator and I train dental offices how to incorporate that type of a philosophy and with what they do. And when you look at someone's mouth, you can see immediately, how their health is. If they're under stress, you can see the changes if you see this patient on a regular basis. So I think all of us are appreciating that more and more, and it is still an emerging field. So, the role you play is so important, so many aspects.
It is. It's but and when people talk about that, many think about the oral bacteria in their mouth and their gums as the way that affects their cardiovascular system, and that's so important. Or an abscessed tooth, which has been shown in about half the time to be the trigger
Yeah.
that causes a heart attack, not the long-term cause, although it is part of the long-term cause, but the trigger, about half of heart attacks.
Yeah.
But there's so many other factors as well.
Right.
The airway, oral myofunctional therapy, and how the mouth develops, and then you get into gut health and many other aspects of oral health as well. Cancer.
Yeah. It's all
related. It's all related.
Yeah. And we are in a position we can really help make a huge impact on people's lives. So,
Yeah.
and with all these connected links and what we see with our patients, you're an oral cancer survivor. Can you tell us about your experience with that?
Oh boy. Yeah, I am an oral cancer survivor. Yeah, back in July of 2019, I had a really bad nosebleed, my first nosebleed ever. It took about an hour and a half at the hospital to stop. I went to my ENT after that, as they told me to, and he said, well, if it happens again, come back. So then we had COVID in 2020, and you think stress can maybe precipitate these events. I do. Shortly after we got back in the office, after closing it for 2 months through COVID, I had a couple more nosebleeds. And so we did a biopsy July of 2020. I was diagnosed with stage 4 metastatic squamous cell carcinoma of the nasopharynx down both sides of my neck.
Yeah.
And they gave me a 50-50 chance of surviving. And so you get that, and you can have many different reactions. Mine was, okay, well, I've got a 50-50 chance of living, so let's go for it. Let's get at it. Let's do what we need to do, And I think that attitude helped me. But I sought the help of everyone around me. A couple of brothers said, get out of the small town, get to a big facility where they do a lot of this. That was a wonderful recommendation. I had some local orthopedic surgeons who are good golfing buddies of mine tell me, be your own health advocate. I said, what does that mean? They said, you'll find out. And you do. You find out. No doctor knows everything. You have to take responsibility for your own health, even preventively before something terrible like this happens. Get in as good a shape as you can ahead of time, which I did. I always did. Tried to be as healthy as I could. And so be your own health advocate. If something doesn't sound right, go further. Ask questions. Go somewhere else till you get the right answers that feel good to you. And one of the orthopedic surgeons, as an example, told me, get immunotherapy if at all possible. It may help reduce the cancer and give you a better chance of survival, might even help reduce the radiation that you would need. Well, my 5 doctors that I was with all said, no, no immunotherapy. No, it's not what you want, or we don't have it for you. finally, the last person I could possibly ask up at the University of Chicago, the fellow doctor who was assisting my regular medical oncologist, said, we might have a program where that might help, where you might qualify a study. And they looked into it, and I did qualify. I said, I'd like to have that. Then all my doctors said, well, that does sound like a good plan. The immuno and chemotherapy, the 9.5 weeks of that reduced my cancer 80%.
Wow.
So again, be your own health advocate was important there. One local oral surgeon told me, extract all your molars before you do this, because I was going to have radiation treatment to my jaws and everything. And if you have an extraction after that radiation, it can be a huge problem. So if you think you might need an extraction at some point, you want to do that before the radiation.
Right.
And I really did things are moving fast. They're moving very fast at this point. Things coming at you every which way. But I gave it all the thought I could. I contacted some other trusted advisors in dental oncology. And with my background of being a dentist and as good a care as I took of my teeth and everything, and I found out they have the best radiation equipment possible at the University of Chicago up in the big city where I went. And I decided to save my molars. Well, in the end, my lower right back tooth is the only one. The back half of that, if I have a problem, I need that extracted, is the only area that would be a problem. So I was able to save those 8 teeth. And again, it was be your own health advocate and research and study till you get the right answer for you.
Yeah.
And many other areas are like that. So anyway, I went through this cancer. It was not fun. I say it's not the best vacation I ever had.
Right.
And so 9.5 weeks of immunotherapy and chemotherapy, that wasn't that terrible. But then the 6.5 weeks of radiation, 33 bouts of radiation, and really strong chemotherapy was brutal.
Oh, yeah.
And,
I can imagine. I mean, you've written this amazing, comprehensive and detailed guide, based on your experience. And it's available, by the way, on oralsystemic.net. So it really helps patients, doctors, and care providers kind of know what to expect. And also what you found really helped you, throughout your own treatment. I know that StellaLife really was, helpful to you, as we have seen with so many oncology patients. So that's an amazing resource, and you put so much in what you learned as you were going through that journey for others.
Thank you. I didn't want to do that. I mean, it wasn't a good thing to recall all of that. It took me, I waited about 3 years, actually, to do it. But I knew I had to do that. I had some patients with oral cancer, and I said, look, I know I need to do, I'll do this for you. So I sat down, I wrote this 20-page document on everything that I had been through and what I learned. And so it is comprehensive on products. It tells the healthcare provider, the dentist, how to make fluoride trays, how to make radiation trays, why. Yeah. It goes into the drugs and constipation and what to do about that. That's a terrible thing, but so prevalent with the medications that you're taking with this. It talks about the oral care regimen. I will say that one of the things that they tell you there is, well, Dennis Abbott, a dental oncologist, told me, whatever you do, keep swallowing. You have to keep swallowing. If you don't keep swallowing, even if it's just liquids, there's so many sores throughout your mouth through the chemo and the radiation especially, that it's hard to eat. It's and you cut it up in little things and eat things that slide down and use sauces and get it down. But eventually it could maybe only be liquids. But he kept saying, keep swallowing. If you forget how to swallow, and it can happen quickly if you quit swallowing, it takes a long time to relearn how to swallow, and
Yeah.
it's terrible. And so at at the cancer center, they told me to use salt and soda rinses to clean my oral sores, and it cleaned them, but it didn't soothe them. And so it was a raw sore that was very hard to swallow with. And a great friend of mine, Dr. Bill Doan, showed me how and helped me build an ozone machine. And he said, use ozone water. And so I ozone rinses. And so I did that. Same thing. It cleaned them very well, but it was raw and it was sore and it hurt to swallow. The one thing that helped me, and God bless Gennady Sirota, your CEO of StellaLife, and I just, several times after my cancer treatment, when I saw him, all I could do was cry and hug him. He got me the StellaLife oral kit of the
recovery kit.
The recovery kit where you have a rinse and a spray and a gel.
Yes.
And he told me how to use that starting a couple days before the radiology started. And so I did. And that saved me. And that saved me from getting a feeding tube. It saved me from being able to swallow. It cleans the sores and it soothes them enough that you can still swallow. And I can't say enough.
Yeah, we're really committed to that.
About how wonderful your company is, StellaLife, how wonderful Gennady Sirota is, and how great your products are. And I would certainly recommend them to anyone. Now, we also use your products, the StellaLife products in our office for tissue healing, and many things. Yeah. So if you haven't looked into, I don't mean to be a commercial for StellaLife, and Gennady, your CEO, he tells me do not do that, Mike. But if there's a viewer here who hasn't tried your products, or a healthcare provider who hasn't used your products for their patient, do it.
It's a life changer for patients going through what you have, which is why we are committed and donate products to those who need it, who can't afford it, as well as, organizations like Oral Cancer Cause, because it is so excruciatingly painful. And when you're feeling that way, it's so easy to lose hope. And it's hard to keep your hope going in any case when you're fighting for your life, which you did. And so
it is.
You're here with us,
Yeah, you're lying in bed and you're awake all but 1 or 2 hours through the night, just kind of hurting and worried. Your mind kind of gets crazy. And I mean, I knew I was going to die. I just knew it. If it wasn't COVID or the cancer or the riots in the city at the time, because it was during COVID and the election and everything. But anyway, I don't know where I was going with that, but
well, it sounds like it was, these types of experiences just change who we are forever. And what's been awesome is that you're sharing this with others so they have a heads up on what to expect and things that they can do. So what advice do you have for dental teams so they can, do more to help detect early? I mean, as a trainer with the JP Institute for over 30 years, we train our hygienists and doctors to do these oral cancer screenings every time they come in for their maintenance or prophy appointments, so their care appointments with a hygienist, and not just once a year, because things happen. I had a patient that from one 3-month appointment to the next came up with a lymph node behind his ear, and I detected it because I did this exam every single time I would see my patients. And just within that short period of time, this lymph node came up, and he had a previous history of testicular cancer, had fallen out of remission. So what else can we do as clinicians and then to detect early, and also how to support our patients who are going through this experience with the cancer?
Absolutely. and you know, you just asked me about 2 or 3 questions at the same time.
How can we as
Trying to
professionals
remember them here.
Yeah.
But yeah, you know, diagnosis is so important. Take the time to do a good diagnosis, and that's for everything dental and airway and etc., but as well oral cancer. You hope you never see one, but you will in your career as a dentist or a physician, and hopefully you'll catch it. So you want to do the thorough clinical exam. Hopefully someday they will have some salivary diagnostics to help us that are accurate, that we can do an easy test like that to help with oral cancer exam. There are things like the Velscope or similar instruments that can be helpful as well. Take the time to look, do a good oral cancer exam, do it each time. And but on the other hand, don't beat yourself up if you do miss something. After my diagnosis, I had 5 physicians trained look at the lymph nodes in my neck, because some of them were golf ball size. Note, not one of them could feel the enlarged nodes in my neck. Now, sometimes you can, sometimes you can't. So don't beat yourself up. But on the other hand, do be aware of it. I had one of the orthopedic surgeons that helped me to get up to the University of Chicago and told me to get immunotherapy. His wife was going through oral cancer treatment at the time, and she passed away. And the dentist, she had a lesion, she around an implant, and she said, "Look, I've got a problem here." And he took a look at it, a local dentist, and he said, and it wasn't me, and he said, "Well, let's watch it." And they watched it for a year. And when it was finally diagnosed, it was squamous cell carcinoma. She lost her mandible, and a couple of years later, she lost her life. And so it's important to do your best to diagnose these things and take the time to do it. Do that. On the other hand, if something's diagnosed later, it's possible that you just couldn't have seen it, and don't beat yourself up because of it, is what I would say to that. Yeah.
Well, thank you so much. Thank you for sharing your story with us and all the resources that you provided. We'll have links available for everybody so they can check these things out, and your ongoing work. So again, it was a pleasure interviewing you. Thank you for your time today. And thank you, everybody who joined us on this talk today, and look forward to seeing you next time when we meet another innovator. So thank you all. Everybody take care and stay well.